Good afternoon, and welcome to today's webinar on Moving Beyond Fear, a conversation about cancer screening. My name is Amy Israel, and I'm with the Office of Community Outreach and Engagement at the Harold C. Simmons Comprehensive Cancer Center at UT Southwestern Medical Center. It is my pleasure to join you alongside a fantastic group of panelists. Closed captioning for today's webinar is available in English, Spanish, and Mandarin. In our office, we do a lot of listening, making sure that what we do reflects the real experiences, concerns, and needs of the communities we serve. Today's webinar is rooted in what we've heard over years of listening sessions with our greater DFW community. First, let's talk about what we mean when we say cancer screening. Cancer screenings are tests to find cancers at very early stages before you or your doctor may notice them. These include mammography, lung cancer CT scans, PSA testing for prostate, colonoscopy, and cervical cancer screening. Since 2020, our office has had the opportunity to hear from over 350 community members across 54 listening sessions in the greater DFW area. For many people, cancer screening isn't just a medical decision, it's shaped by beliefs, life experiences, and real-world challenges. Over time, we started to hear some common themes. Here's a sample of the few of the themes that we've heard over the years. First, like many things in life, beliefs get passed down in families. Many people have shared with us that they were raised to tough it out, that getting sick can feel like weakness, or even like being a burden. We've also heard how easy it is to put screening off. As one person shared, more than one person has shared, if nothing feels wrong, getting checked can seem unnecessary. We've also heard that access isn't always straightforward. For some, it's not knowing where to go. For others, it's a lack of insurance, language barriers, or even trust in the healthcare system. And for many, there's a very real concern about cost and what comes next. What if they find something? As you can see in the last two bullets, other themes that have emerged are our natural human desire to avoid difficult information, or sometimes even the sense that nothing can be done. Maybe you can relate to these concerns, or maybe you're someone who schedules your annual cancer screening on the same day every year as soon as your insurance will allow it. Either way, this webinar is for you because the more we know, the more confident we can feel. At the same time as we've heard concerns over the years, we've also heard something powerful, which we know but sometimes forget, which is that none of us are able to take care of anyone else if we're not able to take care of ourselves. That really speaks to why this conversation matters, because we know that finding cancer early, when it's most treatable, can literally save lives. But we also know that fear, uncertainty, and real barriers can make it hard to take that first step. So today, we're creating space for an honest, practical conversation. Here's what we're going to be talking about. First, Melissa Moreno, Community Outreach Coordinator from the Moncrief Cancer Institute, will talk with us about how to access screening services, whether you have health insurance or not. Brandon McCord, our Director of Patient Financial Access, will talk with us about common financial questions as well as available support. And Dr. Tyler Evans and Haley Umosen will get very practical with us and talk about how to work through some of the common concerns that come up. Our goal today is simple: to help you feel more informed, more supported, and more confident in moving beyond fear and taking the next step for your health, whatever that step looks like for you. We want this to be a candid conversation. Please ask any question that comes to your mind. Feel free to place that in the chat. The only people who will see the chat today are the panelists and the host. So please do feel free to be candid. Thank you so much for taking the time out of your lunch hour to be here with us and being part of the conversation today. And it is my pleasure now to introduce you to Melissa Moreno. Melissa, please go ahead.
Thank you so much. Hello, everyone. I'm going to be going over some cancer screening education, give you some other resources about how to get cancer screening. We'll answer some questions about what to expect during your screening, and other resources. Next slide. Thank you. Our first slide here, we will review the 3 most common cancer types in women and the 3 most common cancer types in men. There you'll see on the left-hand side, in women, the most common cancer is breast cancer, followed by lung, followed by colorectal. For men, there on the right side, you'll see the most common cancer is prostate cancer, followed by lung cancer, and then number 3 is colorectal cancer. Today, we're going to focus on 3 cancers. We'll focus on breast cancer, prostate cancer, and colorectal cancer. Next slide. Starting with breast cancer, many may be wondering, well, what is breast cancer? Breast cancer starts in one or both of the breasts. You'll see an image there of a breast. Often occurs almost entirely in women, although men can also get breast cancer. 1 in 8 women will be diagnosed with breast cancer in their lifetime. Next slide. You may be wondering, what are some risk factors? I have labeled there a couple. We'll go over a few. First up, we have alcohol consumption. This does increase your risk if you are consuming alcohol. Being overweight or obese also increases your risk, especially after menopause. Your risk increases. If you use birth control, not having children, or not breastfeeding, often having children after the age of 30 or 35 will increase the risk. Hormone therapy, breast implants, your age, risk increases as we age. The rate for breast cancer diagnoses in women under 40 are still relatively low, accounting for 4% of US cases, but rates have been slowly rising. Risk increases significantly after the age of 50. Your race, non-Hispanic white women and non-Hispanic Black women have the highest incidence of breast cancer. Personal family history. A strong family history of breast cancer or ovarian cancer can increase your risk. This also includes genetic factors, including inherited changes to genes such as the BRCA1 gene, the BRCA2 gene, slightly increase your risk as well. Having dense breast tissue. This makes it harder to detect tumors when having mammograms. And early menstruation or late menopause. Studies have found that having your early menstruation before the age of 12 or starting menopause after the age of 55, as it exposes your breasts to estrogen for longer. Next slide. What to expect during your screening. There I've listed 2 screening methods. We have a screening mammogram. This is a low-dose 3D X-ray that can help detect breast cancer early. A radiologist will review the images to look for changes in the breast tissue. The second one there is a diagnostic mammogram. This is a more detailed X-ray. It's used to investigate specific breast concerns, such as a new lump or pain someone might be having. Unlike a screening mammogram, a diagnostic mammogram focuses on a specific area of the breast, which often involves taking additional magnified views. Next slide. When should you start being screened? Yearly mammograms for women of average risk should begin at the age 40. Women of higher risk, higher than average risk, might need to screen earlier. That goes back to having maybe a genetic mutation, and screening should continue as long as a woman is in good health and is expected to live at least 10 more years. Next slide. Next, we'll talk about prostate cancer. What is a prostate? We'll start with anatomy. It is a part of the male reproductive system. There you'll see an image with labels. You'll see the prostate, the rectum, the sphincter, the urethra, and the testicles. As I said, it's part of the male reproductive system. It's linked closely to the urinary system. It provides fluid for sperm movement. It's the size of a walnut. Next slide. Now, what is prostate cancer? Prostate cancer is an abnormal growth of the normal prostate cells. This is the most common non-skin cancer in men. 1 in 8 men will be diagnosed during their lifetime. As Amy mentioned earlier, there are no signs of early prostate cancer. Next slide. All right, we have 4 risk factors here that I've listed that we'll review. First, your age. Your risk rises significantly with age, though it's increasing in younger adults' prostate cancer. Your family history. A first-degree relative with colorectal cancer, a first-degree relative with a family history. Also, your ethnic origin. African Americans are almost 2 times more likely to be diagnosed with prostate cancer. And your diet. Next slide. There are a few screening methods for checking for prostate cancer. The first one is your PSA blood test. This measures the amount of prostate-specific antigen in the protein. The next is a digital rectal exam, or a DRE. This is an actual physical examination of the nodules or areas of an abnormal hardness of the prostate. Next slide. When should I start being screened? The age for average risk is 45. The age starts at 40 to be screened if you're high risk. This includes African American men or men with one or more close relative who has been diagnosed before the age of 65. The last cancer we'll review is colorectal cancer. What is colorectal cancer? This is cancer in the colon, rectum, appendix, and/or anus. It occurs when the cells grow too fast and too much, creating a tumor which spreads to the other tissues. This mostly develops from polyps, which are lumps of tissue in the bowel that could become cancer if not removed. 1 in 24 men and 1 in 26 women will be diagnosed in their lifetime. What are your risk factors? Age risks, as your risk rises significantly with age. Smoking, alcohol is linked to increased risk. Family history, as we mentioned, first-degree relatives. Ethnic origin, your diet, your lifestyle, and being obese or overweight. What to expect during your screening. Now, there's several different screening methods here that have been listed. We'll go over a few. The first one and the least invasive one is the fecal immunol fit test. What is that? It's a non-invasive at-home screening test used to detect hidden blood in the stool, which can be an early sign of colorectal cancer or precancerous polyps. The next is a stool DNA test. The next one would be a colonoscopy or a CT colonography. When should I start being screened for colorectal cancer? You should start getting screened at age 45 and continuing until age 75. Screening over the age of 75 should be an individual one, considering the patient's overall health and your prior screening history. What to expect after your screening. Now, you've had your screening done, whether that's a mammogram or prostate or colorectal cancer screening. Next slide. Thank you. Patient navigation at UT Southwestern or at any site where a patient receives their screening, whether that's at UT Southwestern or Moncrief Cancer Institute in Fort Worth, a patient will be guided through their abnormal results and follow-up care. At Moncrief Cancer Institute, nurse navigators can help uninsured patients secure financial assistance for treatment. How to receive a cancer screening. Cancer screenings at UT Southwestern. Overall, most preventative cancer screenings will be covered by insurance. Please call your insurance provider to find out more about your plan. At UT Southwestern, the Cancer Answer Line is a free, confidential service at UT Southwestern's Simmons Comprehensive Cancer Center. They provide guidance on cancer prevention, screening, diagnosis, and treatment. It's available Monday through Friday, 8 to 5. The phone number there is 883-722-6237. They also have an email. At Moncrief Cancer Institute, free cancer screenings are available. We can provide free screenings for breast, cervical, colorectal, lung, and prostate for those who are uninsured and those who qualify. Use the QR code there to request more info. You can also call 800-405-7739 to request an appointment. More cancer screenings. After the webinar, you will find a PDF and we'll have linked different cancer screenings. There's a great UT Southwestern cancer screening guide that goes over some of the cancers we discussed. We also have some American Cancer Society resources, and we have a Moncrief Cancer Institute breast cancer survivorship video. Thank you.
Good afternoon, everyone. My name is Brandon McCord. I'm here to talk to you a little bit about the financial support and some of the questions you may see facing a cancer screening and or diagnosis. So the great news, as you just heard, most cancer screenings are going to be covered, whether they're covered through your insurance company or they're covered through various state, federal, or local grants, or even charities and foundations and organizations such as UT that offer these cancer screenings at no cost. So highly encourage that piece. Next. So now let's talk about kind of the real crux of the issues. What happens when we do get diagnosed with cancer? So this is a great opportunity for a patient to go in and discuss with their insurance company if they're, what their coverage is, their benefits, where they go in network, all the different potential out-of-pocket costs. Many insurance companies have support programs and information, or even patient navigators within their programs that help patients route to the right locations and ensure they receive the best possible care. Also, if you're uninsured, this is when you want to evaluate coverage options, whether it's Medicaid, different options through the exchange, or even Medicare plans. These are available for uninsured patients, and many organizations and hospitals have people who can walk you through this process step by step. And there's also federal programs that do the same thing as well. And then there's so many different foundations out there externally outside of the healthcare system that do support patients out of pocket when they do get diagnosed with cancer. So many drug companies, many federal groups and foundations, and many different nonprofits offer these grants and help patients afford the very potential expensive care that is cancer. But there is assistance programs out there. So what should you do? So right off the bat, if you have insurance, contact your insurance provider and go through that process. Understand where you're in network. Understand what your benefits are, coverages, what if you have any exclusions or limitations. Also, work with your hospital team or your clinical team and your provider to get routed to the right resources. And we spoke earlier about the different organizations, both external and internal in the hospital system. Especially talk to a financial advisor or a financial coordinator that works with the healthcare center to help you understand not just your coverages, but what options there are out there to get additional funding support. One thing to note, if we do not have coverage and we're worried about what do I do now, they're going to deny me. Insurance companies cannot deny coverage based on a cancer diagnosis. This is part of the Affordable Care Act, and it really eliminated a loophole for insurers that would previously prevent patients from coverage. Now they are obligated to provide that coverage and offer that coverage and not eliminate you based upon that. And I think the biggest piece here that we do want to cover, and we kind of want to make sure it comes across, is that you're not alone. There are resources there to support, and we're here for you. Thank you. And now I'll kick it over to Haley and Dr. Evans.
Thank you. We will start talking a little bit about the fear of cancer screening from a psycho-oncology perspective. Let me introduce myself first. My name is Haley Umosen. I'm a licensed clinical social worker and a clinical therapist within our psycho-oncology department. And I'm joined today by Dr. Tyler Evans, who is a psychologist within our psycho-oncology department as well. You may be asking yourself, what is psycho-oncology? So let me just kind of give you a brief definition before we fully get started. Psycho-oncology is a service that specifically helps those impacted by cancer navigate the emotional and social challenges during their cancer process. So here at Simmons Cancer Center, we see people regardless of where they are in their cancer journey, and we tailor individual therapy to be something useful and beneficial to those patients. Addressing psychological barriers and identifying coping strategies. So the research identified psychological barriers that affect individuals from getting cancer screenings. We will address these barriers and identify a coping strategy as well to help overcome some of those barriers. When thinking about getting screened for cancer, you might ask yourself this question: what am I going to find out? As you start to ask this question, you may want to start weighing the pros and cons of doing nothing versus doing something. So think about the positives and the negatives that may come with doing something. So what are the positive and negatives that may come from doing a cancer screening? And then what are the positives and negatives of not doing that? So kind of giving yourself this like pro and cons list of why I need to be doing this cancer screening. Next, it is important to recognize that being proactive is better than being reactive. Being proactive means taking care of something before it happens or even in its early stages. Being reactive means acting in response to something that has already happened. So by getting a cancer screening when you are needing to get one done or your doctor's recommending this, that means you are being proactive by addressing your health concerns before it becomes problematic. Tackling action increases your control. Anxiety happens when we are faced with a situation outside of our control. By taking action to get a cancer screening, you actually increase the control that you do have over the situation and its potential outcome. Here are some questions that you might want to start asking yourself that may allow you to think differently about getting screened for cancer and any potential risks or benefit from doing so. What is the worst possible outcome? What is the best possible outcome? And then what is most likely? Asking yourself, will avoiding the screening change the actual outcome? What would I tell a friend or a family member in a similar situation? What will not finding out do for me? Remember, avoidance does not reduce your risk for cancer. If you don't find out now, it does not mean that the issue or the concern goes away. Next slide. And I'll let Dr. Tyler Evans go ahead and join us for this portion of our presentation.
Thank you, Haley. As mentioned, my name is Dr. Tyler Evans, psychologist in the clinic, and I am going to talk to you about managing fear of the unknown. So as we think about anxiety, by definition, part of the definition for anxiety is fear of the unknown. I don't know what's happening, and it's creating some of that anxiety. So something that could also be helpful is grounding. Grounding is a technique that is used to help you be present in the moment and decreases rumination about the past or the present, or about the past, sorry, or the future. It helps us stay in the present moment. It can also help with distant present issues. For example, what's going to happen immediately after the screening. Grounding helps us focus just on one piece at a time, which in this situation would be the screening and nothing beyond the screening at that point. A common technique that is used anywhere and everywhere to help engage in grounding and be present is called the 5 senses grounding technique. There is an image that displays it, and that is naming 5 things that you can see around you, 4 things that you can feel or touch, 3 things you can hear, 2 things you can smell, and 1 thing that you can taste. This exercise can be extended or shortened by doing some of these, one of these, all of these. You can also go beyond the suggested number that is mentioned, but again, the goal is to bring you back to what is happening around you. Additionally, something that can be helpful for managing the fear of the unknown is preparing for the wait. There may be a wait time between screening and results, so figuring out what to do during the time to help manage fear of the unknown. That can look like many different things. That can be engaging in activities that keep you occupied and busy. It can be continuing to go to work until you figure out those results. Really anything that keeps you engaged until you know what happens. Something that is important is deciding if you're going to look at the results on the portal or if you're going to wait for a call from the doctor's office. If you activate the portal, you will get appointment reminders, but you will also get results often before the doctor has had a chance to call you or their staff has had a chance to call you. Sometimes the results can be difficult to understand, leading to someone potentially trying to interpret the results, which may not be accurate and create some anxiety. Other times, people might wait to receive a call from the doctor or the doctor's office to discuss the results and what they mean. So determining what would be best for you when you get those results and how you want to get those results. And then planning for the anxiety by identifying, again, those activities that you can do. I just want to normalize anxiety in this process. Anxiety is normal for all humans, especially when going through something like this. Identify things that are going to help you during that time to get through that anxiety. Next slide, please. And then something really important is becoming your own advocate. Haley mentioned the research, and part of that research of why some people might not want to get screened is some anxiety that they have about what the process looks like from start to finish. And so another technique that can be really helpful is becoming your own advocate. Part of that is being prepared to ask questions, writing them down as they come up, or if you choose to do your own research, make sure it's from a reputable source, write down questions that come up from that research. Additionally, you can bring them with you to a phone call that you might have, whether or an in-person appointment. So either or, if it's in person or by phone, you can get those questions answered. And then lastly, understand communication differences. Each provider in our system is very unique and communicates very differently. And so asking for clarification if you need it, asking for more information if you need it, and then following up if something is not clear. Thank you.
Great. Thank you all very much for sharing that information with us. This is excellent and really helpful. Time now for an open conversation. And I want to invite our participants who are with us today, listening in, to put comments in the chat, to ask any questions that you may have. And as people are thinking about their questions and what they want to comment on, I have a question to dive a little bit deeper. Haley, it really struck me when you talked about the value of being able to exercise control over something, that there is value even when there's a difficult situation, that even if there's just a piece of it that we can control, that we work on that part. And I was also thinking about one of the comments we heard in our listening session from someone who had smoked for 20, 30 years, who had this sense of, there's nothing I can do because I have this history and what's done. And yet we know that regardless of someone's history and anything that may be in the past, that early detection is the very best way to have the best prognosis if someone receives a diagnosis. So I was wondering if you or Dr. Evans could speak a little bit to how we approach situations where maybe there's been a time in our lives when either we haven't exercised the way we want to, we haven't eaten the things we want to eat, perhaps we've smoked, but here we are now. How do we move forward and be proactive about our health?
I think sometimes it's having like a non-judgmental look at ourselves and realizing the past is the past. We made these choices and it's okay, right? That's the choice that we've made. And non-judgmentally looking at ourselves and realizing we made those choices now, but we can make different choices in the future. And just because I smoked for 20 years does not mean I have cancer. It might mean I have a higher possibility of that happening. So what can I do now? Kind of taking control of the moment instead of living in the past and thinking of those things. I can stop smoking. I can change my diet. I can get a cancer screening and talk to my doctor about other ways to prevent or reduce my risk of cancer. Those are some things that I would suggest.
Thank you. Thank you very much. Thank you very much. Brandon, thinking about what you talked about and the role of your financial counselors, and I know that we're right now building out our financial counseling team even more. Can you talk a little bit about some of the common things that your counselors hear from patients and any specific advice you might have about specific questions that people might ask their counselor?
Absolutely. I think the biggest right off the bat advice would be to know your financial counselor, get to know them and reach out and have conversations. They have a lot of knowledge and a lot of experience in this space. I think the common questions we see and get from patients are, what happens if I lose my job, or I have lost my job and lost my insurance coverage? What do I do now? Or I'm changing coverages, or now we're not in network with your organization. Or what do I do? And so all these different things, any kind of coverage change or any kind of coverage setback, right? We want to talk to someone and have that conversation about what we can do next and what we can do to help fix that and mitigate that, because there are solutions to all of these financial problems out there. Even one we had very recently, or what can I do? Have this expensive drug is covered, but I still owe $5,000 out of pocket. We were able to work with that patient and find an external grant through a partnership that we have through this company that comes and works with us. And we found funding out there for the patient. So their potential $5,000 out of pocket now was zero out of pocket. And so that patient was able to just, kind of reduce stress and really still move on with their cancer care.
Thank you. Part of what I'm hearing from that is what you shared earlier, that no one is alone in this process. And I think that while you didn't say it directly, what I'm also hearing is that there's nothing to be ashamed of, right? That when it comes to, a lot of times when it comes to our finances, many of us are reluctant to speak about our personal situation, but it's so common, I think, and very normal to have real financial questions that, like you said. So I appreciate the approach of your team. Let's see, we've got a question to the panelists. Should someone who has a first-degree relative with cancer be screened? And will this make them uninsurable? Melissa, do you want to speak to that question? And I can add on to that.
Yeah, absolutely. Knowing your medical history, knowing your family history is very important, as we were talking about with your risks increasing. So knowing that is wonderful. It can increase your risk. That is something that you'd want to talk to your doctor about, also your family member about, find out more of when were they diagnosed, what kind of treatment did they have. Knowing their age, you can go back to your doctor and have a conversation with them. This is what's going on with a relative. They were diagnosed at this age. This is what they had. Then you can come up with a plan.
Thank you, Melissa. And I'll add to that, it's a great question. So thank you for putting that in the chat. That at UT Southwestern, and specifically in the Cancer Center, we have an amazing genetics team. And so in many ways, you're absolutely right that having a first-degree relative may make someone have more of a disposition. They will also ask a number of other questions that will help fine-tune the degree of cancer risk. And so, I really encourage anyone who has that question to reach out to our genetics team. We can in fact put that information in the follow-up packet. Thank you. I see one other comment in the chat. Thank you. Melissa, one other question. Bryn, did you want to add to that question?
Yes, following up on that previous question asked, would this make them uninsurable? No, it would not. It's illegal for insurance companies to prevent you from obtaining insurance based on a pre-existing diagnosis. That's what this would fall under if that is the case. But no, it will not make you ineligible for insurance by any means.
Thank you, Brandon. That's a really important piece. Melissa, following up on that question, one of the things I know, because we work together, is that through the early detection programs that are offered both, in the locations of UT Southwestern, including at Moncrief Cancer Institute, that there is a very high percentage of cancers that are detected early because people had early detection. And so I want to emphasize again for everyone listening in, right, that the reason we do cancer screenings is because many cancers do not have a single symptom early on. And so this helps us detect very early. Can you speak a little bit to some of the risks or the impact of holding off?
Yes. As you mentioned, early detection is key. The sooner we can find out if something's going on, the earlier that we can get on top of it and start treatment or maybe surveillance, whatever that might look like. So yes, early detection is key, taking advantage, knowing when to get screened, what age it starts. It's definitely going to possibly help reduce the risk, but early detection is key. So knowing when to start to get screening, talking to your doctor about when to start to get screening and where can I go get a screening is crucial.
Thank you. I want to again invite anyone who's listening in, if you have any additional questions, we're happy to take them, any additional comments that you'd like to share, and also invite the panelists that are here today. If there's anything that you've thought of as you're hearing other people's comments that you would like to share, just open the floor.
Sometimes including friends or family in the screening process can be interesting. I read an article about some celebrities that would have like a colonoscopy party where they would all do their colonoscopy prep together. So that can kind of take, I think, some of the fear away, some of the anxiety away when you're doing it not alone. So if you have friends or family who are like of similar aging, needing to have cancer screenings, why not include them in that process as well?
And Haley, I think asking the questions, what was your screening like? What can I expect? Can we schedule it together? I think sharing that experience with others, it can be very helpful because you kind of feel like you're kind of going into it alone. If you're turning 40 and you're getting your first mammogram, that's not something usually you've talked about with your friends, possibly. So sharing that experience, it was easy to schedule. All I had to do was call. I was in and out. I think sharing those experiences as well about the screening can be very impactful as well, because we often hear the flip side of what happens after we got screened. But what about when I was in the screening? How easy it was.
That's a great point. I love the idea of the party, and it makes me think years ago when Katie Couric, after she lost her husband, did a colonoscopy, I think on camera, right? And the impact that it has. So I think the more we talk about these things, the more this becomes an open conversation, the more comfortable and sort of natural it becomes. Many times we hear in a marriage, in a family, that maybe there's one person who's really on top of their screenings, and the other person who needs to be nudged along. That's not at all uncommon. And so maybe you are that person listening in today who needs that nudge, and maybe you are the person who does the nudging. We have a comment in the chat. Remember not to ignore symptoms, and to seek care with healthcare provider if any symptoms begin to occur. Absolutely, absolutely. Google provides many answers, but it does not provide great answers on all of our questions, and many times can lead to more anxiety. So please do, we really encourage you to reach out to a healthcare provider for those questions. Great. Well, again, we really appreciate everyone tuning in today. I thank the panelists. I thank our community advisory board who gave us feedback, and to all of the people across Greater DFW who've taken the time to participate in our listening sessions over the years, as well as the Office of Community Outreach and Engagement and the Cancer Center. Thank you again for being with us, and have a great rest of your day.